Hello, I'm Dr. Jonathan Amspacher, and I'm a board-certified plastic surgeon, and I wanted to take a few minutes today to talk with you about breast reduction. Breast reduction is an issue that comes up very frequently. People say that I've got really large, heavy breasts that have weighted me down, caused a lot of neck and back pain, and what could be done to help out with those things. And we always talk with folks and we say the first place to start with these issues is with your primary care provider, and you look into issues such as changing the exercise habits that you have, weight change, weight loss, specialized bras, and then physical therapy can be a very good option for some folks, as well as anti-inflammatory medications. But frequently I still have patients that have tried those conservative measures and they still haven't gotten relief, and they've got neck and back pain that really bothers them over a period of a lifetime. And so they come into us and they ask what surgical options are available to us. And so there's very strict criteria, and in some cases insurance companies may or may not cover breast reduction surgery. And what that is it's a surgical procedure where we reduce the volume of the breast, and then we come back and lift the breast, and so you get a lifted breast that weighs less and causes a great reduction in many patients' neck and back pain. It's not a surgery that fixes everybody, but it is a surgery that can give relief to quite a few people over time. And so the things that you want to think about are, have I tried the conservative measures? And then, is this something that my insurance will cover? We do it for out-of-pocket costs too. Sometimes we do another similar surgery that's called mastopexy. And mastopexy is merely just a lift of the breast to get it back into the position that isn't as affected by gravity and lift it back up to the ideal position with a nipple and areola in the central portion of the breast. And so there's a couple of procedures that are available. What we do is we look at generally the volume of tissue that's allowed to be resected in a weight, and that tells us what insurance is likely to cover. We create an estimation of the amount of tissue that we would resect, and then we send in a letter to insurance companies, and then they tell us whether this is a volume that they would approve or not approve, and then it's a surgery that can be done on an outpatient basis in many cases. I always tell folks I wouldn't expect that you can get 100% relief of your pain, but we frequently offer people a very high percentage of relief, and I think that it's a very happy surgery. Very frequently patients go, oh, I wish I'd done this years ago because it made such a difference in my neck and back pain. And so it's something that I think has a very good outcome in most cases. There's risk and benefits with it just like every surgery, but there's some of the basics that you wanted to think about and look at is, will my insurance cover it? Have I tried the conservative modalities? And am I past some of the other key points in my life?